Here's a shocking truth your doctor might not have time to tell you. The single biggest predictor of whether you'll maintain your independence, avoid surgery, or even survive a hospital stay isn't your blood pressure or cholesterol. It's your leg strength. If you're over 60 and notice it's getting harder to get out of a chair, climb stairs, or walk without feeling unsteady, you're not just getting old. You're experiencing sarcopenia, age-related muscle loss, and it's accelerating faster than you think. Research shows that after 60, adults can lose 3 to 5% of muscle mass per decade, and the decline in leg strength is even more rapid. But here's the hopeful part. This process is largely reversible, and you don't need a gym, special equipment, or to even get on the floor. The solution is right under you, your chair. As a fitness specialist working exclusively with seniors for over 15 years, I've seen this transformation firsthand. I've watched clients postpone knee replacements, recover from hip surgeries in record time, and regain the confidence to travel and play with grandchildren, all starting with simple chair exercises endorsed by orthopedic surgeons and geriatric specialists. In this comprehensive guide, you'll discover the surgeon-approved chair exercise that targets the number one most important muscle for preventing falls. Why traditional walking isn't enough to rebuild leg strength after 60. The 5-minute pre-hab routine that could help you avoid surgery entirely. How to adapt every exercise for arthritis, osteoporosis, or joint pain. The common chair exercise mistake that 90% of seniors make, and how to fix it. But first, let me ask you something important. When you rise from your favorite armchair, do you ever push off with your hands or feel a momentary unsteadiness before taking your first step? If you answered yes, you're experiencing what geriatricians call subclinical weakness, the early warning sign that your leg muscles need targeted attention now. Keep reading, because what comes next could change your mobility trajectory for the next decade. Chapter 1. Why your legs are failing you, and it's not just age. The silent muscle thief, sarcopenia explained. Let's clear up a dangerous misconception first. Weakness isn't an inevitable part of aging. It's largely the result of disuse. The phrase, use it or lose it, was practically invented for muscle tissue. Here's what's happening inside your body right now. Every day, your brain sends signals to your leg muscles to contract and rebuild. But if you're not giving those muscles a reason to stay strong, through specific, challenging movements, your body starts to reallocate resources. It's a cruel efficiency system. Muscles that aren't being used are metabolically expensive to maintain, so your body lets them atrophy. The leg strength and independence connection. Consider these sobering statistics from the Journal of Gerontology. Adults with weak leg strength are 4 times more likely to develop disability in activities of daily living. Poor quadriceps strength specifically increases fall risk by 76%. After a hip fracture, only 50% of seniors regain their previous level of independence. Question for you. Have you noticed tasks that were easy 5 years ago now require more effort or planning? The walking fallacy. Why your daily walk isn't enough. This might surprise you. Walking alone does virtually nothing to maintain leg strength after 60. Here's why. Walking is primarily a cardiovascular activity that uses your muscles at a low percentage of their capacity. To maintain, and especially to rebuild, muscle mass, you need to challenge your muscles against resistance. This doesn't mean heavy weights. It means working against gravity in targeted ways that walking doesn't accomplish. Think of it this way. If you had a leaky roof, would you patch it with tissue paper, walking, or with proper roofing materials, targeted strength exercises? Both might cover the hole temporarily, but only one provides lasting protection. The good news, the exact type of resistance training needed to reverse muscle loss is perfectly suited to chair exercises. They're safe, controlled, and infinitely adaptable. Chapter 2. The Surgeon's Secret. Why chair exercises beat everything else. What orthopedic surgeons really think about seniors and exercise. I recently interviewed Dr. Michael Chun, an orthopedic surgeon specializing in joint replacements, and his perspective was illuminating. Asterisk, when patients ask me what they can do to delay or avoid knee replacement, I don't tell them to walk more. I tell them to strengthen their quadriceps and glutes through controlled, non-impact movements. The single best tool for this isn't expensive equipment. It's a sturdy chair. Proper chair exercises can reduce surgical candidates by up to 30% if started early enough. Asterisk. The surgical perspective. Surgeons see weak leg muscles as the primary reason for falls that lead to fractures. The biggest obstacle to successful recovery after joint replacement. A modifiable risk factor that's often overlooked until it's too late. The number one most important muscle you're probably ignoring. Meet your quadriceps femoris, specifically the vastus medialis obliquus, VMO. This teardrop-shaped muscle on the inner side of your knee is your joint's primary stabilizer. When it weakens, your kneecap doesn't track properly. You develop that wobbly feeling when standing. You compensate by leaning on furniture or people. Your risk of falls increases exponentially. The surgeon-approved VMO activator. The seated leg extension with a hold impulse technique is renowned in physical therapy circles for targeting this crucial muscle without joint stress. Try this quick assessment right now. Sit tall in your chair with feet flat on floor. Slowly extend your right leg until it's straight. Tighten your thigh muscle and hold for 5 seconds. Does your knee feel stable or does it shimmy slightly? Do you feel more activation above the knee or on the inner thigh? If you felt more engagement above the knee or noticed shaking, your VMO needs specific attention. Don't worry, the next chapter addresses this precisely. Chapter 3. The complete 5-week chair exercise protocol. Important safety disclaimer. Before beginning any exercise program, consult with your healthcare provider, especially if you have osteoporosis, joint replacements, cardiovascular issues, or balance concerns. The exercises below are for educational purposes and should be tailored to your individual needs by a qualified professional. Week 1 to 2. Foundation phase, building stability. Exercise 1. The surgical prep quad set. Why surgeons love it. Prepares the neuromuscular connection without joint movement. Safe even immediately after surgery. How to do it. Sit tall with back supported, feet flat. Place hands on thighs just above knees. Press down gently with hands while simultaneously trying to lift thighs against resistance. Hold for 10 seconds. You should feel your thigh muscles engage without your leg actually moving. Release and rest 5 seconds. Repeat 10 times, twice daily. Progression. Try it without hand resistance once you understand the muscle activation. Question. Did you feel the engagement more in your right or left leg? Most people have a dominant side. This awareness is the first step to balance. Exercise 2. Seated marching with purpose. Why it's approved. Improves hip flexion without compromising balance. Essential for stair climbing. How to do it. Sit toward front of chair, holding sides for support. Lift right knee towards ceiling, keeping foot flexed. Hold for 2 seconds at the top, focusing on squeezing your hip flexor. Lower with control. Take 3 seconds to lower. Alternate legs for 12 to 16 total lifts. Perform once daily. Common mistake. Swinging the leg up using momentum. The magic is in the controlled lifting and lowering. Weeks 3 to 4. Strength building phase. Exercise 3. The delay surgery chair squat. Evidence-based benefit. A 2018 study in arthritis care and research found that chair squats reduced knee pain by 40% in osteoarthritic patients. How to do it. Stand in front of chair, feet shoulder-width apart. Hold onto something stable, countertop, sturdy table, if needed. Slowly lower, as if sitting, keeping knees behind toes. Lightly touch chair with buttocks, don't plop down. Pause for 1 second, then rise without using hands. Start with 5 reps, work up to 12. For arthritis sufferers, only lower halfway initially. Range of motion improves with consistency, not force. Exercise 4. Calf raises for circulation and balance. Medical rationale. The calf muscle acts as a second heart, pumping blood back upward. Weak calves contribute to swelling and poor balance. How to do it. Stand behind chair, holding for support. Rise on toes as high as comfortable. Hold for 3 seconds at the top. This is crucial. Lower slowly over 3 seconds. Perform 10 to 15 reps once daily. Question: do you notice any difference in stability between doing these with eyes open versus closed? Only try eyes closed with a caregiver present. Week 5 plus. Integration and progression. Exercise 5. The get off the toilet drill. Functional application. Mimics the exact motion needed to rise from low surfaces. How to do it? Sit on chair. Use cushion to increase height if needed. Cross arms over chest. Lean forward slightly, planting feet firmly. In one smooth motion, rise to standing using only leg power. Pause standing for 2 seconds, then slowly lower. Build to 8 to 10 reps. Game changer tip: place a higher pillow on your favorite chair to practice with decreasing assistance. Chapter 4. Tailoring to your specific condition. For osteoporosis, the spine-sparing modifications. Critical rule: avoid forward flexion and twisting under load. Here's how to adapt. Instead of forward-leaning chair, stands do seated leg presses against wall. Instead of traditional marches, do straight leg raises while maintaining neutral spine. Always focus on alignment over range of motion. Question for osteoporosis readers: have you received specific exercise restrictions from your doctor? How do they align with these suggestions? For knee or hip replacements, the recovery timeline. Post-op weeks 2 to 6. Stick exclusively to seated exercises without weight bearing. Weeks 6 to 12. Begin partial weight bearing as approved by your surgeon. After 3 months, incorporate standing exercises with substantial support. Important: your surgical team's protocol always overrides general advice. For arthritis, pain scale guided approach. Use the 0 to 10 pain scale during exercise. 0 to 3 pain during exercise equals green light, continue. 4 to 5 pain equals yellow light, reduce range of motion or resistance. 6 plus pain equals red light, stop and modify. Remember, some discomfort from muscle work is normal. Sharp joint pain is not. Chapter 5. The psychology of consistency. Making it stick. Why 90% of seniors quit, and how to be in the 10%. The biggest barrier isn't physical capability, it's psychological. After 60, we've spent decades associating exercise with sweat, discomfort, and gyms. Chair exercises feel too easy to be effective, so motivation wanes. The mindset shift you need: view these exercises not as workouts, but as daily movement medicine. The habit stacking method that works. Pair exercises with existing habits. Do quad sets during morning news. Do calf raises while brushing teeth. Practice chair stands before each meal. Track differently. Don't count reps. Count days moved. Use a simple calendar checkmark system. Focus on consistency, not perfection. Question for you: what's one daily activity you never miss? Coffee, medication, favorite TV show? Can you pair one exercise with it? The social component: why going solo fails. Research shows that accountability increases exercise adherence by 300% in older adults. Your options: virtual buddy system. Check in with a friend after exercises. Family involvement. Teach grandchildren your secret strength moves. Online communities. Share progress in senior fitness groups. Chapter 6. Nutrition and recovery. The missing pieces. The protein timing most seniors get wrong. Muscle protein synthesis decreases with age, making nutrient timing crucial. The rule: consume 20 to 30 grams of protein within 30 minutes of your chair exercise session. Easy post-exercise options: Greek yogurt with berries, cottage cheese with pineapple, protein shake, whey or plant-based, 2 hard-boiled eggs. Question: do you currently track your protein intake? Most seniors consume less than half of what's needed for muscle maintenance. Hydration's hidden role in muscle function. Muscles are 75% water. Even mild dehydration reduces strength output by 10 to 20%. Your new rule: drink a glass of water 30 minutes before exercising and sip throughout. Sleep, the secret recovery tool. Growth hormone, essential for muscle repair, is primarily released during deep sleep. Poor sleep sabotages your chair exercise efforts. Prioritize 7 to 8 hours with consistent bedtime. Chapter 7. Red flags and when to see a professional. Normal versus concerning pain. Normal, muscular. Dull ache and muscle belly. Symmetrical on both sides. Peaks 24 to 48 hours after new exercise. Improves with gentle movement. Concerning, joint/medical. Sharp, stabbing pain in joint. Swelling, redness, or warmth. Pain that worsens with movement. One-sided symptoms. Urgent signs. Chest pain, shortness of breath, dizziness, or sudden weakness require immediate medical attention. Finding the right professional. When to see a physical therapist instead of just doing YouTube exercises. After any recent hospitalization or surgery. If you've fallen in the past 6 months. When pain limits daily activities. For personalized progression planning. What to ask. Do you have experience with geriatric strength training and chair-based protocols? Conclusion. Your path forward starts today. Let's return to the question that opened this guide. Are you over 60 and noticing your legs getting weaker? If so, now you understand this isn't a life sentence. It's a wake-up call with a clear solution. The chair exercises outlined here aren't just light activity. They're a targeted, surgeon-endorsed intervention that can delay or prevent joint replacement surgery, reduce fall risk by up to 50%, maintain your independence for years longer, improve quality of life through enhanced mobility. Your action plan doesn't need to be complicated. This week, start with the Week 1 foundation exercises. Commit to just 5 minutes daily. Next month, progress through the phases, listening to your body. 3 months from now, reassess. Can you rise from a chair without using your hands? Do stairs feel more manageable? Has that unsteadiness diminished? Final question for you to consider. What's one activity you've stopped doing because of leg weakness that you'd love to reclaim? Is it gardening? Traveling? Playing with grandchildren? Walking without fear? Share your goal in the comments below. Writing it down and sharing it creates powerful accountability. And if you found this guide valuable, share it with a friend who might be struggling with the same challenges. Remember, your strongest years might still be ahead. They start with your next gentle, controlled, purposeful movement right there in your chair. Frequently asked questions, FAQ. Question: I'm over 80. Is it too late for me to benefit? A, absolutely not. Research shows muscle strengthening is effective into the 90s and beyond. Start gentler and progress slower, but start today. Question: how soon will I see results? A, neuromuscular improvements, better control, less shaking, often appear in 2 to 3 weeks. Visible strength gains typically begin at 6 to 8 weeks with consistency. Question: what's the best time of day to do these exercises? A, whenever you'll do them consistently. Many find mid-morning ideal when energy is higher and joints have warmed up through morning movement. Question: can I do these if I have a knee or hip replacement? A, yes, but with specific timelines and modifications. Always follow your surgeon's protocol first, and use these as supplementary once cleared. Question: what if I miss a day or several days? A, simply resume. Consistency over the long term matters far more than perfection in the short term. The body responds to what you do most days, not what you miss occasionally.